Good morning, everyone. How are we? We're good? Excellent. Congratulations on coming here today. This is an important forum, and I'm really pleased to be able to join you to be here. Can I begin by acknowledging my colleague, the Honourable Peter Tinley, MLA, Minister for Housing, Veteran Affairs and Youth, the Honourable Chief Justice Wayne Martin AC, the Mental Health Commissioner Tim Marnie, Director General of the Department of Community Services Graham Searle, Acting Commissioner, Corrective Services, Department of Justice, Tony Hassel. Can I also acknowledge the Chairperson of Shelter WA, Mark Glasson, and the Acting Executive Officer of Shelter WA, Joe Kalia, and Barry. Barry, I've heard those songs many times. Brother, don't stop singing them. It's important for you to remind us where we are and where we're going to. So thank you very much for your welcome to country. And I'd like to join Barry in acknowledging that we stand today on the lands of the Whadjuk people of the proud Noongar Nation, and I join you all, I'm sure, in acknowledging their elders, past and present. It's very pleasing to see so many people here today ready to engage on these important issues. And the state government recognises the fundamental right of all Western Australians to a safe and secure home. For many people with severe mental health or alcohol and other drug issues, access to safe, secure accommodation also requires the provision of well-coordinated support. A critical component of the pathway to recovery for people experiencing mental health or alcohol and other drugs issues is having a stable house. System reform is needed to ensure that this is possible for all Western Australians. It is clear that good outcomes for individuals can only be achieved if people are at the centre of our service systems. It's certainly our focus in the health system under the McGowan State Government around our policies of putting the patient first. And we also talked about innovation, integration, and culture change. We understand that there are a multitude of complex issues regarding the intersection of mental health, illness, housing and homelessness. Almost 10,000 people are experiencing homelessness in Western Australia on any given night. This is a shameful statistic, and it's one that we cannot tolerate. The majority of people with mental illness who are homeless experience long-term homelessness and repeated episodes of homelessness. Evidence also suggests that mental health issues are increased or exacerbated by the experience of homelessness. Some people face significant difficulty in meeting their basic needs, such as shelter, adequate income security and food. As a result, they are overrepresented in the homelessness population. This includes a significant number of people with severe mental illness. Nationally, 1 in 4 people who receive assistance from a specialist homelessness service in 2015-16 identified as experiencing a current mental health issue. Support for a mental health issue is not the main reason people seek assistance from a specialist homelessness service. However, when all reasons for seeking assistance are considered, mental health issues are considered second most frequently reported concern, slightly behind the common reason, which is of course financial difficulties. Young people leaving care, many of whom are a higher predisposition to mental illness, are particularly vulnerable to homelessness. In the absence of emotional support, a place to live and other material support provided by parents or supportive friends, young people with a serious mental illness are at a very high risk of homelessness. For those on low incomes, there are limited private rental dwellings available, which allow people to spend less than 30% of their income on rent, particularly in urban areas. In addition to housing affordability crisis, many people with a severe mental illness face stigma, discrimination and social exclusion, which impacts on their ability to access private housing and to an extent social housing. Research has found experiencing a long-term health condition such as mental illness are more likely to experience multiple disadvantages, such as low income and assets, difficulties finding and keeping a job, housing stress, and poor health. People with a mental illness who are homeless often experience iterative long-term homelessness, cycling between sleeping rough on the street and movement through transitional housing, substandard accommodation, hospitalisation, and for some, incarceration. People experiencing these living conditions are at a heightened risk of victimisation and violence and have little control over their environment. It is difficult for mental health services and the individuals themselves to address the mental health issues and move towards recovery and sustainable participation in social and economic life in the community when they are homeless or living in a substandard accommodation. Similarly, without access to affordable, safe and appropriate housing, it is impossible to break the cycle of homelessness and help people to better manage, reduce or prevent mental health problems. I am committed to working together with service providers and the community to address these complex issues. The West Australian Mental Health, Alcohol and Other Drug Services Plan 2015-2025, Better Choices, Better Lives, was released in 2015. The plan outlines the optimal mix of services needed for the mental health system for that 10-year period. The development of a system-wide multi-agency accommodation and support strategy to address the needs of individuals with mental health or alcohol and other drugs issues is identified as a priority area within the plan. The Mental Health Commissioner has been developing the strategy in consultation with consumers, families and carers, service providers in the housing and mental health sectors, peak bodies and other government agencies. This will be the first strategy of its type in Western Australia. It represents a significant way forward in responding to the accommodation and support needs of people with mental health and or alcohol and other drug issues. The aim of the strategy is to establish a framework that will guide how accommodation and support will be planned and developed over the next 8 years. The McGowan Labor government is committed to implementing the integrated approaches and developing a more cohesive human service system to ensure better outcomes for people. The strategy emphasises a greater collaboration between government agencies, non-government organisations, the private sector and consumers, carers and families to provide coordinated support and access to accommodation for people with mental illness and or alcohol and other drug issues. I understand the Mental Health Commissioner, Mr Tim Marnie, will be talking about the strategy in more detail just shortly. And as Minister for Mental Health and Health, I am determined to ensure that there are clear access pathways into and between a suite of accommodation and service options to suit individual needs. West Australians with mental health and or other alcohol and other drug issues should not be getting stuck in long stay hospital beds for lack of accommodation or community options. The benefits of secure, safe and affordable housing chosen by the individual and augmented with suitable health and community supports as required are well documented. They include improved health, improved sense of belonging and self-worth, improved social and economic participation, reduced reliance on welfare support and reduced impact on homelessness services, and reduction in hospitalisation. To create an optimal service system requires coordinated partnerships across mental health, housing, community services, health, justice and private sectors. The state government welcomes cross-agency initiatives and collaboration. We want to be part of a collaborative and partnership approach to homelessness and mental health. Significant change in this space, however, can only be achieved by collective effort. I'm heartened to hear of collaborative work that is already underway, such as 50 Lives, 50 Homes project, in which services are implementing innovative and structured approaches to achieve positive outcomes and lasting change for people experiencing homelessness. My Cabinet colleague, Mr Peter Tinley, the Minister for Housing and I, will be working closely together to address these issues and to ensure they remain at the forefront of the government's agenda. We look forward to working with you to ensure appropriate accommodation and support is available to assist people with mental health or alcohol and other drug issues so that they can have a good home and a good life in the community. I'm delighted to be here with you today and even more delighted to launch this forum. Have a great day, everyone, and all the very best for your deliberations. Thank you.